Hello friends, welcome to my channel. Today's video is based about the clavicle, so let's get started. Clavicle. The highlighted bone present in front is called the clavicle. It is also called as the collarbone and the beauty bone. Peculiarities of the clavicle. Clavicle is the only long bone that is present horizontal in the body and is throughout cutaneous. It is the first bone to start the ossification process. It has two primary centers for ossification. Medullary cavity is absent in clavicle. Occasionally, the clavicle may be pierced by the medial supraclavicular nerve. Features of the clavicle. Clavicle is convex in its forward two-third portion and concave in its backwards one-third portion. It has a shaft, which is also called as the body of the clavicle, the lateral end, also called as the acromial end, and the medial end, also called as the sternal end. The green color here represents the shaft, the yellow color represents the acromial or the lateral end, while the orange color represents the sternal end or the medial end. The lateral end has a facet that articulates with the acromion process of the scapula to form the acromioclavicular joint, whereas the medial end has a facet that is quadrangular in shape and it articulates with the clavicular notch of the manubrium sterni to form the sternoclavicular joint. The articular surface further extends downwards to the inferior aspect for articulation with the first costal cartilage. Clavicle can be subdivided into lateral one-third portion and medial two-third portion. For the lateral one-third portion, the clavicle has the anterior border, the posterior border, the superior surface, and the inferior surface. Whereas for the medial two-third portion, we have anterior surface, posterior surface, superior surface, and the inferior surface. The inferior surface of the lateral one-third portion bears a tubercle and the ridge. The tubercle is known as the conoid tubercle and the ridge is known as the trapezoid ridge. The medial two-third portion has a groove called the subclavian groove and an impression for the attachment of costoclavicular ligament. Attachments. The red shades indicates the origin, whereas the blue shades are for the insertion and the green color represents the ligaments. In the middle end, the margin of the articular surface gives attachment to fibrous capsule of the sternoclavicular joint all around. We have articular disc that is present posterior-superiorly, the interclavicular ligament superiorly. The interclavicular ligament connects right and left clavicle together. At the lateral end, the margin of the articular surface gives attachment to the joint capsule, the conoid tubercle, and the trapezoid ridge. Both of them gives attachment to the conoid part and the trapezoid part of the coracoclavicular ligament. The lateral one-third of the shaft. The anterior border gives origin to the deltoid muscle, whereas the posterior border provides insertion to the trapezius muscle in the lateral one-third portion. The medial two-third portion, most of the anterior surface, gives origin to the pectoralis major muscle, whereas the subclavian groove give insertion to the subclavius muscle. The margins of the subclavian grooves give attachment to the clavipectoral fascia. The medial portion, half of the superior rough surface, gives origin to the clavicular head of the sternocleidomastoid muscle, and the posterior surface of the medial close to the medial end gives origin to the sternoid muscle. The oval impression on the inferior surface at the medial end gives attachment to costoclavicular ligament, whereas the subclavian groove at its lateral end has the nutrient foramen. The nutrient foramen is a branch of the suprascapular artery. The nutrient foramen provides nutrition to the clavicle. Ossification. The clavicle is the first bone in the body to start the ossification process. Except for its medial end, it ossifies into membrane. It ossifies from two primary centers and one secondary center. They have two primary centers which appears in the shaft between 5th and 6th week of the intrauterine life, and both of them fuses at about the 45th day of the intrauterine life. The secondary center for the medial end appears during 15 to 17 years and fuses with the shaft during 21 to 22nd year. Occasionally, there may be a secondary center for the acromial end. Clinical anatomy. The most common site of fracture for the clavicle is the junction between the lateral one-third portion and the medial two-third portion, being the change of the curvatures in both of them. The lateral fragment is displaced downwards because the weight of the limb cannot be supported by the trapezius muscle alone. So this fragment gets displaced downwards. The clavicles may be congenitally absent or imperfectly developed in a disease called cledocranial diastosis. In this condition, the shoulder droops and can be approximated anteriorly in front of the chest. Thank you for watching this video. Don't forget to like, share and subscribe to my channel. Also hit the bell icon for the new updates. Thank you.